Right. Okay, so welcome to this Q&A session on the NIHR, that stands for National Institute for Health Research, Applied Research Collaboration Greater Manchester, Social Care and Social Work Research Training Opportunities. My name's Dr. Penny Lewis and I am the Academic Career Development Lead for the ARC Greater Manchester, and I'm also Senior Clinical Lecturer in Pharmacy Practice at the University of Manchester. So today's session is quite informal. You have the opportunity to ask as many questions as you like. Can I ask Alison to just keep an eye on the chat for me? So you can either, we've got throughout the session, there's particular spots where you can ask a question, or you can pop them in the chat as well if you prefer to do that. So I'm going to start by explaining what ARC Greater Manchester is. So as I said, it's the Applied Research Collaboration Greater Manchester. And it is NIHR, so National Institute for Healthcare Research, infrastructure funding. So the NIHR fund various different infrastructure, so organisations that can support staff working in various sections of health and care research. And there are lots of other NIHR infrastructure funding or organisations that you may have heard of. There's one called the NIHR BRC, Biomedical Research Centre. There's a Patient Safety Research Collaboration. So there's a few of these organisations around, but this infrastructure funding, the ARC-GM, is all about applied health and care research, hence the name Applied Research Collaboration. And the ARC Greater Manchester is really a collaboration between all of the health and social care systems across Greater Manchester. So we work really closely with all of the health NHS trusts, and also with social care organisations that operate within Greater Manchester kind of footprint. And we work across the different higher education institutions, so the different universities that we have across Greater Manchester. So many of us may be from the University of Manchester, but we also we have people that are involved in the ARC from Manchester Met, from Salford University, from Bolton University, so all the different universities across Greater Manchester. And importantly, we are a collaboration with the people of Greater Manchester. So we have a strong patient and public advisory board, and we also work with sort of charity organisations as well. And like I said, the ARC GM is really about applied health and social care research that is responding to the needs of the local population. There are 15 ARCs across England, so there's a fair few of them. And they all look slightly different in terms of what their focus is. It's all applied research, but their kind of themes, their topics that they're interested in may vary. The themes that we have in our ARC in Greater Manchester are mental health, digital health, organising care, economic sustainability, healthy ageing, evaluation, and implementation science. I think they're the right ones. And we also have additional teams. The capacity building team is one of them, and the public and community involvement and engagement team. So I've already introduced myself. So I am the lead for the capacity building theme or the capacity building team. And today on the call, we've got Alison. Alison is our capacity building program manager. We also have Dr. Ross Atkinson, who is our capacity building program manager, so works across all of our programs. We're joined by Dr. Caroline Lee, senior lecturer in mental health and social work. And Caroline's going to do a bit of talking later on about our research champions. Deborah Ward is Assistant Programme Director in Greater Manchester Adult Social Care Transformation Team. And we're also joined today by Jo Finnerty, Assistant Programme Director in Greater Manchester Adult Social Care Transformation Team. Does anybody want to say anything else at this point, or shall I carry on? We'll all join in, I'm sure, when it comes to questions and answers, so you'll get to see some of us and know who we are. So The National Institute for Health Research is really committed to increasing research capacity in social care. And they are doing this by funding, awarding funding. So our ARC has been recently awarded some funding to increase research capacity and offering opportunities in social care. And the reason for this is that research capacity, so improving the skills and knowledge of people within systems and within social care, really ultimately will improve the type of research that we do, generate more research, generate more evidence, but it's also about how we can better introduce and implement evidence that already exists. And all this really is about improving outcomes for those that need health and care, need care and support. Our opportunities that we're offering are for those that work both within adults and children's social care services across Greater Manchester, who want to develop their career and gain research experience. And as you can see from our team, we are working with partner organisations, so Greater Manchester Association of Directors of Adult Social Services and NHS Greater Manchester, the Greater Manchester Social Work Academy, MMU, and the University of Bolton. So we are working across the spectrum of organisations that are interested in and working within the social care arena. So today I'm going to talk about the different opportunities that we have available to people working within social care who are interested in research. The programs that we're going to talk about are internships, and these are for those that really want to just dip their toe into research. So they have very little experience or no experience in research, but they really want to explore this a bit more. Our pre-doctoral fellowships, and these are for people who have some experience in research, but they want to go on then to develop a PhD proposal. And research champions, and these are for those that are passionate really about raising that profile of research within the social care setting. And we're going to go through these opportunities in a bit more detail now. Before we do that, the timelines for applying for these opportunities are that for all of them, the application deadline closes on the 24th of January, Friday the 24th of January. We will begin a process of shortlisting the week beginning the 17th of February. And then in terms of interviews for the internships and the pre-doctoral fellowships, these will happen on the 27th of February, and for the research champions on the 3rd of March. And you can find guidance and some frequently asked questions online. If Alison, if you could put that link into the chat for me so people can see that if they've not seen it already. So in the guidance for applicants, we do ask that you give these a read before applying. They've got some useful information in there. For the interns and pre-doctoral fellowships, that guidance actually relates to both of those programs. So don't be confused if you think, oh, where's the other one? They're together. And there is also only one online application link for the internships and pre-doctoral fellowships. And in that application, you have the opportunity, you can select which of those programs that you want to apply for. But if you are applying for the pre-doctoral fellowship, bear in mind that you can actually tick both. So if you weren't successful with the pre-doctoral fellowship, perhaps we felt that you didn't have sufficient experience at this point in time to apply for that, we might decide that you could be offered an internship. So please tick that box if that's something that you would be interested in. For research champions, remember to read the FAQs, and you can apply via an online link to a Pacific Research Champion application form. If you do have any queries about those forms or any problems at all, or you have any accessibility requirements, let us know. Either email Alison, or we have a generic ARC-GM email address that you could use as well. And we'll get back to you as soon as we can. For all of our opportunities that we're going to talk about today, you need to be a graduate. You could be a graduate in social work, you could be an occupational therapist, social care, work for a social care provider, be a commissioner, or work in social care policy. If you're not entirely sure about your eligibility, then obviously do email us. It's key that you are currently employed by a social care or social work organisation in Greater Manchester that offers services within the Greater Manchester footprint. And this, you could be working in either or both adults and children's services. You could also be employed by an NHS trust, a local authority, a care provider that could be residential or domiciliary, or you could be employed by a voluntary sector organisation as well. So we're really flexible in terms of where you are employed. But if you do have any queries about your eligibility, then just drop us an email or ask some questions now if you want to. So for the internships, we are offering up to £20,000 back full funding. So that's paid directly to your employer. So we can't pay you directly for attendance on this internship. This funding does go through an employer, hence why you need to be currently employed. It is intended as those at that very sort of early sort of level in research. So you may have no experience in research or just a little bit. But you do need to demonstrate that you're, really interested in learning a little bit more about what research is, what that looks like, what skills you might need to develop, and have perhaps some ideas about kind of areas of research that you might be interested in, or understanding or improvement work. It may be that you want to network with research staff and broaden that the list of the people that you know in this. And you want to undertake some training. You will be supported by a supervisor from one of our ARC themes or by one of our partner organisations. And we find you that supervisor through a matching process. So we look at what your needs are and what your interests are, and then we find somebody that we think is best placed to provide you with a great learning opportunity. We like to make it clear that it's not really intended for candidates to undertake their own research projects. And sometimes we get people that apply that, perhaps have developed a new service and they want to evaluate it and do some research on that service. The time that you spend wouldn't be spent on a particular project such as that, but we would provide you with some skills that would be useful for you doing that in the future. These internships are quite short and it's all about your development. However, if that was something you wanted to do in terms of working on your own research project, we would look at the skills that you would need and point you in the direction of the best kind of training opportunities that would help you do that in the long term. So the internship is structured around the needs of each intern because everyone is different. They come from different places, different experiences. As an undergraduate, perhaps you've done some postgraduate learning. So everyone is quite different, but everybody gets support from the capacity building team, supervisory support from their supervisor. They will undertake their own some individualized research activity of some form, and that could be working alongside existing research activities, and think about what learning they want and where they hope this takes them. Training opportunities available to all interns, pre-doctoral fellows and research champions. And we have a whole sort of catalogue, a huge sort of catalogue actually of training and development resources at the University of Manchester. And so you'll be provided with login details to access all of that training. You also have the opportunity to undertake a master's level research module. And you could undertake that formally. And by formally, I mean that you possibly could undertake the assessment associated with a master's level master's unit and receive some credits for that. However, that does take quite a substantial amount of time in terms of the hours of learning that you undertake. So we also offer an audit only access, and that basically means that you can log in to the materials because these units are typically online and use sort of video lectures, etc. You can access all of those resources without sitting the assessment that's associated with that. And you can access multiple master's units as an audit kind of only access. And those kind of discussions about what you want to do would be in conjunction with your supervisor, who will help guide you as to what would be most appropriate for your learning needs. You also get access to the resources that we have within the ARC capacity building team for through the lifelong learning portal, which is basically it's based on Blackboard, but different universities use different platforms. It's just an online platform that you can log in and access video recordings of various training sessions that we run on things like developing a research question, good clinical practice and ethics and other resources that we generate throughout the year. And you will also have access to learning resources through NIHR Learn. And they have some high quality kind of video learning that you can do in various different topics, again, all depending on what your needs are and what your interests are. So in your application, you need to describe why you want to do an internship. What is it that has inspired you to apply? Like I said, you might have very limited experience in research, but there'll be some sort of rationale for you thinking that this might be of interest to you, and you know what are you passionate about? We always ask, what do you want to be able to do at the end of the internship that you can't do now, to understand what your priorities are. Internships are fairly sort of short, really, in the scheme of things. So it's good to know what your priorities are, and then we can use that information to match you with a suitable supervisor. We want to know a bit about how the internship might help you in your future career aspirations. And we also need to know a little bit about finance in terms of what are the costings that are associated with your time. So I urge you, if you haven't already, to speak to people that perhaps within your finance department who can provide that information for you. So have we got any questions about the internships at this point in time? I can't see anybody. So Alison, you just,
Yeah, we've had just one question in the chat was around whether if an applicant is affiliated with a university rather than a healthcare organisation, is it possible to have the bursary funding managed through the university? And I've just sort of replied saying you would need to be employed through a health or care organisation. We can't fund through a university. And also just to mention that this recording will be added to the website, so people who haven't been able to attend will be able to see the recording afterwards.
Okay, thank you, Alison. Okay, I'm going to move on to the pre-doctoral fellowships. Again, this is a maximum of £20,000 backfill funding. It can be up to 0.5 full-time equivalent over 12 months. And it's, as I've mentioned previously, it's for those with some experience of research who want to undertake a PhD. So you need to sort of be clear that that's what you want to go on to do. And it's really ideal to give people the headspace and the time and the training to input into applying for a PhD, a competitive PhD. Pre-doctoral fellows have the same access to training as the interns, so all the same resources. It's at this kind of stage, it's likely that you might want to undertake a formal unit in a master's level research module to sort of improve understanding in a particular area. But the training resources are similar, but because you've got more time, then that's the formal master's modules might be appropriate. We will allocate pre-doctoral fellows up to 3 supervisors, and we try and match pre-doctoral fellows with supervisors who have the relevant experience to what the topic that of interest. However, if you have links with potential supervisors already, then absolutely that's fine. Please include that information in the application. We always use this 4 Ps for success when looking at particularly pre-doctoral applications, and it applies to PhD applications as well. So we're looking at the person and what your background is, your experience to date in research, what you would bring to this process. We're looking at the place, so where you work, is it prime for research? Have you got support networks? If you haven't, don't let that put you off, because obviously we know social care is less research intensive than perhaps healthcare. So that's fine, but think about what the opportunities in the place that you're working in to develop that research agenda and take that forward. We're interested in the proposal. So we're interested in your idea for your project, your PhD project. You may not have fully developed that, and that's absolutely fine. That's why you have the time to work that up. But where is your area of interest? What is the gap, or what is the problem that you're interested in exploring in a bit more detail? And how might you go about that? So what kind of training might you need? What patient and public engagement might you want to do? So we'll be looking at the project itself. And then what is your potential? So looking to see where this might take you. Where do you see yourself going? What kind of funding streams do you think you might apply for? In terms of your application, we want to know a bit about your professional background and why you're interested in research and what you've done so far. Timelines, provide a Gantt chart by email if you want, if that's preferable to you, but you don't have to. Just how are you going to set out your time during the pre-doc and what you're going to work on when. Any particular training that you would like, so you can put any specific courses or modules, and how much they might cost. And what do you plan on doing during the fellowship? How will you use your time, which maps onto the Gantt chart? How your work is then going to contribute to a PhD proposal. So what you're working on during the pre-doctoral fellowship, how will that build yourself up to that ultimate kind of PhD project? And again, we need finance. So do make contact with the finance department to find out more details about that. Have we got any questions about the pre-doctoral fellows?
Just one question around how many days a week is it for the pre-doctoral fellowship? I'd said that it's negotiable, but does tend to be 0.5 full-time equivalent.
Yeah, so up to sort of 2.5 days.
I think
Typically.
Sorry, come on.
No, yes. Helen's got a question.
Yeah, I mean, obviously you're saying that the days is negotiable. I'm just, and does it have to? Because what I'm considering is something that would involve both health and social care. Would that still be acceptable?
I think so. In terms of the project,
Yeah.
I think if it's got a social care element to it and that's significant, then I think we'd be interested. I mean, by all means, drop us an email and sort of outline your idea, and we can think about it a little bit more and get back to you sort of on a one-to-one basis. It'd probably be preferable to do that than you apply and you get feedback that it's
Yeah,
not.
because I actually work for an NHS trust.
Okay.
But my background is actually social work. So I'm a registered social worker. But my role is slightly different. It's slightly different now, and it's within a trust.
Yeah. No, and I think we're really happy to accept applicants from sort of NHS employed by NHS Trust. That's absolutely fine. And in terms of your project, just drop us an email. I think it's likely going to be absolutely fine, but for we can have a discussion about that and offer you some guidance if need be. Helen.
Okay, thank you.
Okay, so I'm going to hand you over to Caroline, if Caroline's available.
Yes, I'm here. Thank you. Thank you for that, Penny. So I'm going to talk now for a few minutes just about the role of research champions, which is a relatively new role that was introduced this year. And we currently have 2 research champions who are doing great work actually, and from very different areas of social care, social work practice. So the role of the research champion really is to network across the system. So having a think really about, are you interested in being research active? Are you aware of the benefits of being research active? Are you aware of the benefits of research in terms of improved outcomes for service users, carers, the people that you work with? Are you aware of how research can promote quality in practice and quality in outcomes in terms of practice improvement too? So the role is very open, so it might be that you're interested in, a smaller area of promoting research as a champion. For example, maybe you work in a residential home and you want to build networks across a number of different residential homes in that particular area to really upskill the staff and therefore have better benefits for the residents in those homes. Or it may be that you're in a professional role in social work or social care, and you've seen that there are maybe gaps in where research should be taking place, and you want to find out what those gaps are, and then you want to champion and promote how you might be able to communicate those gaps to others so that the profile of research might be raised and something might be done about research in those areas. So in terms of how it's backfilled, the research champion role is backfill funded for up to 1 day a week for 12 months. So that's obviously quite a significant time investment for you in recognition of the role itself and the importance of that role. And it's, as I say, it's really suitable for those who are keen to promote evidence-informed practice, research-informed practice, and to raise the profile of research within social care. So as I say, I've talked about some of those networks for identifying high priority research areas. There's lots of different networks across Greater Manchester. Obviously, some of them are part of the Greater Manchester Social Work Academy, some of them are part of the networks that residential homes have, and some of them are part of networks that private, voluntary and the independent sector also have. So, we're very open to those networks and to you sharing how those networks work and how also they can be more research and evidence informed to improve outcomes across social care. One of the things that you might like to do as a research champion is you might like to learn how to design and develop what's called a feasibility study. So a feasibility study in a nutshell is basically with a research proposal, an idea of something that you think might need to happen in order to improve outcomes, in order to test the waters, so to speak, for a piece of research to establish if that's actually going to be doable or not. And throughout this process, you've got all the resources available via the NIHR and also via this particular project as well, in terms of the learning resources that are based at the University of Manchester too. You're also supported by me as your mentor. I'm Caroline, I'm a senior lecturer in mental health social work, and I'm also an active researcher myself. And my research specialism is around mental health, but I'm also a mentor for other programs as well, and I'm a coach as well as a mentor, so I'm a qualified coach too. So you get that opportunity to work with me and with Alison too, and the broader team as well. So I think that's probably as much as I'll say. If anyone's got any questions, then please do. Even if you think it's silly, just ask the question, because you can guarantee if someone else is thinking of the question and thinks it's silly, somebody else is too.
Thanks, Caroline. Got any questions for Caroline?
We've not had any questions. Irvin had asked earlier, just working in Pristine Health Solutions, they're a home care service with research interest, and asking if there are opportunities for organisations like them to promote research in the community. So I said the research champion role does sound like it would be something suitable for colleagues there. Irvin, I don't know if you want to add anything to that.
Yeah, thanks, Alison. Yeah, so it's I think exactly what Caroline has explained. And I think the champions, research champions, it does fit into exactly what we are looking at. So obviously, I think you've explained very well, and I'm happy. We can discuss maybe, offline after the meeting. We can schedule meetings because that's exactly what we're doing.
That sounds good. And
That's wonderful.
I think the next slide actually also just mentions the application process as well for the research champions.
Oh, yeah. Okay.
Yeah. Do you want me to go through that?
If that's okay, Caroline.
Yeah, of course it is. Yeah. Okay. So in your application, we'd like you to describe why you want to apply for the role of research champion. So, what's important to you? What sort of value base do you come from? Why is it important now as well? I think, there needs to be some reflection on why research needs to take place now. What's the currency of the piece of research role? Sorry, say that again. What's the currency in terms of the research champion role? In terms of what you're thinking of doing in those networks, and what knowledge and skills to the role, and what knowledge and skills do you want to develop during the 12 months. We did start off with a skills audit for the research champions this year, and that's been really, really helpful in targeting areas for development and progression. So we can also do that with future research champions as well. How will the Research Champion Award help you in your current role and in your career aspirations? I think that's really key. And then finally, the financial information. So the costings associated with your time that you'll need to provide to us from your finance department.
Thank you, Caroline. Okay, so this next slide just highlights for you the differences between the different programs in terms of the time, the duration. You can clearly see the funding and then your supervisors and the deadlines, etc. So that's a useful thing for you to have a look at. I think these slides will be available to you if you want a copy as well. Okay, so I'm going to stop sharing now so we can see people, which is nice. Stop sharing, there we go. Right, so that's the end of all of our slides. Has anybody got any questions, or has any of the capacity building team want to say anything else that we've not covered today?
All sounded quite thorough to me, Penny.
Okay, thanks.
Yeah, Penny, I was just going to say that actually we already do obviously have people from adult social care working with us as part of the internships and research champion program. So there's a good opportunity to network with those who are maybe a slight step ahead, who you could buddy up with. So that's always a really good opportunity. And it's, being able to have contact with people like Caroline and Joe and the rest of the team is a really good sort of networking opportunity.
Yeah. I think it's what we find people really benefit from, because it can be quite isolating in health and social care in those settings. So it's linking up with those that have similar sort of ambitions. Joe?
It was just to make the offer really on behalf of me and Debbie, who unfortunately couldn't join today, that obviously we're working with all those different, some of yourselves on the call, and the providers and so on, and that link I think somebody mentioned across to health. So anybody that wants a conversation, to maybe flush out some ideas and so on, based around our knowledge from and experiences, I guess, from across the sector, we're more than happy to do that.
Oh, that's brilliant. Thank you very much, Joe. I don't think there's any more questions. Yeah, we can share the recording. That's absolutely fine, and we will make sure that everyone's got that attended today. Yep, I think that's everything in the chat. Thank you everyone for coming today. Thank you for the team for your support, and best of luck with all your applications. But don't hesitate just to drop us an email if you do have any queries that come to you after this, and we'll get back to you as soon as we can. Thank you very much.
Thank you. Bye.
Thank you.
Thanks.
Thank you.
Bye. Bye.